Imagine you were asked to pick the speakers for TEDx Boston's Longevity Summit. Who would you choose? That happened to me, and then I got a sobering call from Maid and Ted saying they were very concerned. The longevity space is filled with profiteers and people making bold claims without solid evidence to back them up. Ted wanted no promotions, no bold claims not backed up by solid evidence. In other words, no conspiracy theories, no recommending drugs like metformin for off-label use, no medical advice. And then they asked, "What is your plan for vetting these speakers, punk?" Okay, I may have imagined that they were going to add that word punk to the end of their sentence. That call will probably always live in my head as we interview people, as it did when we interviewed cardiologist Columbus Batiste. But it was this interview that got us to invite him to TEDx because, as you'll see, he is extraordinary. Sure enough, he lit up the stage and got raves from the audience and the TEDx team.
Do I get points from you for wearing a red shirt, like Tim Williams did?
So, absolutely yes. You get more points if this were February.
Oh, yeah.
First of all, I mean, I know that you're one of the GOATs, right? I see that, but why off the jump do you have to just stand me up and have that beautiful red sweater on in time for this show, right? I mean, I couldn't find my red sweater.
It's all about February. You talk about Heart Month. It's Women and Heart Disease. The Red Dress campaign, wearing red because women for the longest time have had heart disease in this country that was under-recognized, undertreated, under-managed, and we're trying to get over that.
February is Heart Month. Heart awareness. It's such an important thing to bring awareness for women's health as well as just heart disease in general. So it's insane, but even in 2024, recent studies have shown that nearly 60% of Americans did not know that heart disease is the #1 killer.
Yeah.
And so you think, man, is there anyone on the face of earth who would not know that heart disease is the #1 killer? But there are.
Yeah.
So we have a lot of work to do.
Yeah, a lot of work to do. So you describe your career as being a plumber for Kaiser.
Yes.
Can you describe what that means?
Yeah. So, I mean, there's different types of heart docs there are. So we have like our body and fender guys, we have our electricians, and we have our plumbers. So the heart is comprised of the structure of the organ itself, of the heart itself. And that's the structure. So you have doors, you call those valves, that allow blood to flow in a singular direction. You also have the electrical circuitry. Yeah. So just like you have a light switch that you turn on, there's an area of the heart where it activates one singular area called the sinoatrial node, that then delivers an impulse that travels around the top chambers and coalesces inside of a middle portion called the AV node and disseminates out, just like a circuitry for an electrician.
Yeah.
And then you have guys like me who are just blunt plumbers, right? We're going into the coronary arteries and we're unclogging the vessels to reestablish blood flow. But the difference with plumbers, they're taking out the clog.
I see.
They're taking out the blockage. We're not. We're repositioning it against the wall, or we're rerouting blood flow around it, is essentially what we're doing.
Yeah. So is that with a stent and then it expands, squishes the...
Yes. So I always use the analogy with stents. Stents are just like, you've been married, right?
Oh, yeah.
Married. How long you been married?
50 years.
50 years? Can I get your book?
A lot of people have asked, oh, you wouldn't believe my background, but that's not what this interview's about.
But I'll always joke and say, if your wife said to you, honey, I want you to clean out that closet, and that closet has 50 years.
I would do it immediately.
Of course you would.
Right, honey?
Of course you would, right? 50 years worth of all of her collections. And she tells you, don't throw one thing away.
Yeah.
So you get the bright idea, I'm going to build permanent book shelving inside there. You put all of her stuff up on the shelves and she's happy at that point in time, right? She's dancing around.
Yeah.
You haven't taken anything out.
Yeah.
If she continues to accumulate in the same fashion, that closet's going to junk up again, right? Same thing happens with coronary arteries. We're repositioning the blockage.
You're accusing my wife of being a hoarder?
I absolutely am not. I have a wife of 26 years. I may be dumb, but I'm not stupid.
No, you look too young for 26 years. But anyway, you were saying...
So we reposition the blockage against the wall of the artery, and we have a wire mesh that keeps it there.
I see.
Right? So we don't take the blockage out.
Yeah.
So there's no cure.
Yeah.
There's nothing that happens. This is just a temporary solution to
Yeah.
reestablish blood flow.
And it's going to plug up again if they don't change their lifestyle.
It absolutely has been demonstrated that it may plug up again, if not inherently from lifestyle,
Yeah.
maybe just a reaction in their body from multiple factors.
Yeah. Wow. So we read your new book. Fantastic.
Thank you.
Loved it. But it was a shocker. I didn't expect a book like this. I expected to hear about mitral valve prolapse or something like that. And this book, Selfish, is more about lifestyle and emotional aspects, sense of humor, and so on. So Michelle's better than I am at dealing with all that. So she's going to interview you in the second half, and I'm going to talk about mitral valve prolapse or
All
whatever.
right. Yes.
Why do you do what you do? I mean, you're here at a conference to help people change their lifestyles. You're not getting paid for it. You pay to do this. You could be making bank as a cardiologist, but you choose to do this, and you choose to write books like that, which is trying to put you out of business.
Yes.
Because if people do this, they're going to get a whole lot fewer stents, right?
That's right.
So why do you do it?
It's the right thing to do. You know, they say that service is the rent we pay for living on this earth, right?
Mm-hmm.
And so when you've gone through life and you've lived life and you recognize the fact that you've had family who've suffered, you've had friends who suffered, and when you think, if there's an opportunity that I can keep someone from really suffering,
Yeah.
why wouldn't I do that? You know, it's funny, as you mentioned that, it reminds me of my kids early on. So my kids now are 19 and son is 17. And so I remember I started this probably about 12, 13 years ago, 14 years ago, somewhere around that time period. So they were pretty small. And they would say, Dad, wait a minute, why are you talking to people about changing their lifestyle? Don't you get paid to put stents in?
Yeah.
He goes, aren't you taking money out? Why would
Yeah.
you do that?
Yeah. Why would you do that?
And I said, because it's the right thing to do. It's a part of the treatment that everyone needs to understand. Everyone needs a chance to understand that you're worth it, right? That you're actually worth it. And we can't treat our cars better than we treat our bodies. We can't treat our purses and our watches better than we treat ourselves. And once you start to understand and you treat your body like a business, not as an afterthought, you realize that it is mind, body, and spirit that goes into creating this idea of health.
Is it hard sometimes when you get patients in and you see how clogged their arteries are and you say, this was all preventable?
Well, I try not to carry a judgmental tone because you never know. I don't know what a person's experiences are. That even if I tell you that 55 to 60% of individuals who are genetically predisposed towards cardiovascular disease, right? What does that mean? That means that 55 to 60% will have resolution if they treat themselves aggressively with lifestyle. That means that 45%, even if they do that, will still succumb to disease. When you're born, you're going to die. So I can't be judgmental about a person where they're at. But what I can do, and my responsibility, is to provide them with all the therapeutic interventions that they can use to transform themselves. And the idea is that it's not one or the other at a certain point, right? So if I'm dealing with you at age 5 or a pregnant woman before she gives birth to her son or daughter, in that moment, now I'm intervening before there may be disease or at the very early onset. When I see patients, oftentimes, they've had an event. So it's going to be more of a combination approach of using traditional therapy along with aggressive lifestyle in some instances. In other instances, it can be solely lifestyle if they're willing to embrace the truth.
I see. When you and Kim Williams were talking, could you introduce Kim Williams?
Yeah. So Kim Williams is a phenomenal human being, first and foremost. He also is an exceptional cardiologist. He was a former president of the American College of Cardiology. He holds many titles, many degrees, sits on national committees, has been an advisor to the White House. And so I call him a friend, I call him a mentor, and he's also aggressive from a lifestyle perspective.
You guys were hilarious together.
You know what? I enjoyed him.
I thought that was a great episode. And for anybody watching, I'm going to link that in the description because it was awesome.
You know, he's a Renaissance man. He does a lot, you know? I mean, he's an athlete. and an avid tennis player. And when you look at that connection between tennis and the mind, and you look, there's so many facets to this thing called health. And so he really encompasses so many of them. So it was a wonderful conversation because we're mixing in the components of traditional cardiology, the risk factors, the therapeutic interventions, the power of lifestyle, the impact of some of the choices that, or I shouldn't say, some of the things we're bombarded with, right? Because, we oftentimes say, just make a better choice. But can I make a better choice if I don't have options around me?
Yeah.
And that's really the question that comes in. If I'm hungry, if I'm flying into an area that doesn't have anything else around it right now, and I don't have food for the next 12 hours, and all I know is there is a shop down the road.
You smell the Cinnabons at the airport.
It's hard to say no to that.
Yeah. You mentioned tennis player. He was still is,
Yes.
an amazing tennis player. He threw out an amazing statistic there. He said, in terms of promoting longevity, tennis is the king of the sports of exercise for promoting longevity. 17 years.
Yeah.
But he wasn't sure what about it was contributing to the 17 years. Can you recall that conversation?
I do recall that. I remember being astounded by that statistic. Briefly looking to see if I can find that data on it. I couldn't. But as I thought through it, I thought about the strategy. I thought about the dexterity. I thought about the agility, right? All those things. So when you look at longevity, what's one of the things that really impacts individuals as they get more mature in years lived, right? Falls, their core strength, their muscular tone.
Yeah.
You have to have all of those in order to play tennis at any degree of level that's there.
I always hear about strength and balance.
Yes.
Strength and balance, maybe endurance and all that. But to me, am I wrong in thinking coordination is just as important to keep from falling? If you play soccer or tennis or something like that, you're much more likely to be able to fall right and not break your shoulder and tuck and roll and all that stuff.
Yeah, I don't think they're disjointed. They go hand in hand, right? So if I'm having core strength and I know that I'm not prone towards falls, I'm also coordinated, which means what? I can lift my foot. I'm not dragging my feet, that I'm able to turn the corner. I can navigate stairs. There's a level of integration because you're talking about a component of proprioception, your awareness of what's around you. And all those components are extremely important in terms of longevity. It really is.
So you were talking about various athletes. He goes to the Australian Open every year.
Yes.
And sits there with his laptop and works while he's at the Australian Open. And puts his laptop down when he watches Djokovic play, because Djokovic is amazing.
Yes, he is.
And he credits Djokovic being plant-based as one of the reasons that he's amazing.
Yes.
And that he's stayed a little more injury-free than Nadal and Federer and all that kind of stuff. And you guys mentioned some other athletes. This was a year ago. You had this. But you didn't mention Jaylen Brown, and you seem like a sports fan. You know about Jaylen Brown and the
Recently.
Celtics?
Recently, I've become aware, truth be told, that's hard for me to say. I like him. I literally sent out a message to a group of people. I'm an avid, diehard Lakers fan.
Oh, no.
So for me to appreciate anyone from the Celtics, it hurts me to even say it out loud.
Yeah.
But he's a phenomenal human being. It's hard to not. From what I've read, he's very much into helping communities.
Yeah.
He's obviously self-aware in terms of what he's feeding his body. And I'll tell you that one of the things that we identify in all these professional athletes, some of whom are just more plant forward, some are solely plant-based. There's the awareness of the impact and the power of nutrition. And I bring this to patients up all the time. And the reason why is, why do athletes care about nutrition? They say, well, because they want to perform. I said, why do they care about their performance? Because that's their business.
Right.
That's how they make money.
Yeah.
We have to understand that our business of our health is equally important. And that when we begin to kind of invest in our sleep, our nutrition, our relationships, all these things play such a vital role. So Jaylen Brown, when I read that about his journey and him adopting a plant-based dietary approach, I wasn't surprised.
Yeah.
I wasn't surprised.
So we should tell people who Jaylen Brown is.
So
he had a pretty good year.
He is a part of the current world champion Boston Celtics. It hurts me to say those words out loud, right? But now we're one championship below them, but I have to give them credit.
Well, not just a part of it.
Yeah.
He's the MVP.
He's the MVP.
Yeah.
Yes.
And he said going plant-based at age 24 changed his life.
Yeah.
It's life-changing for him.
I did an interview with John Sally years ago.
Yeah.
And so John Sally, what he brought forth in the interview is the level of mental clarity when he was on the court
Yeah.
and the elimination of dumb decisions when he was there and ability to kind of see a plan to the end.
Yeah.
And so I imagine that's in part of what Jaylen Brown saw.
That's what he says.
You know,
That's what he
funny
says.
part was we hired, now he's been with us 5 years, one of our new partners in cardiology. And so like everyone, I began to indoctrinate them about the power of lifestyle.
Yeah.
So I started telling this young interventional cardiologist about it. And so he said, okay, I'll try it.
Yeah.
So about a week or two later, he's like, I don't know if it's all in my mind, Columbus, but I don't know, I have like this clarity. I said, it is all in your mind because the food is affecting your mind, right? It's actually impacting you, you know? So we had this kind of back and forth and he was talking about, I just don't know if I can sustain it, but man, I do feel a lot better and everything else. And I said, well, that's kind of odd that you would say you feel better, but you want to go back to feeling poorly.
Yeah, but it can't sustain.
Yeah.
I heard Andrew Huberman say, I don't want to try being plant-based because I'm afraid I'll perform better and I'll think better. And I love my steaks. And I think Messi is plant-based during the season.
And then it goes off.
And then he goes off in the off season.
It's amazing. Well, my own niece, I'm gonna call her out right now. I won't call her names. I have multiple nieces that are lawyers. I have a family of lawyers.
Oh, she's going to sue you.
She might. That's why I won't say her name. And so when she was taking this particular niece, when she was taking the boards, the bar exam.
You sound like a doctor.
I know, really boards, right? The bar exam at that point, she went plant-based. And so
for mental clarity to pass the bar.
And so after she finished, I said, so are you going to stay? She said, no, I don't think so. I said, well, wait a minute. You went there so you could perform better, both mentally and everything else. And so we had this ongoing debate. You would think we were inside of a law court of some sort, you know.
Yeah, interesting. Well, this has been fun so far, but now I'm going to go to a dark place. What's AFib?
Yeah. So AFib is an irregular heartbeat. And so you remember I started talking about the electricians of the heart.
Yeah.
And when we speak about electricians of the heart and the way the heart works, the heart moves from a single cadence. It's like a band conductor that sets the tone. And it says, here's the rhythm. The heart's very rhythmic, very musical. And it's like loved up, 60 to 100. Sometimes the heart rate will be in the 50s, sometimes a little bit more, but that's the rough range.
30s for me.
Yeah. But all of a sudden, you can have the band conductors being usurped. And all of a sudden, you have multiple people saying, I'm the band conductor. No, I'm the band conductor. And you have all of a sudden, all these signals being sent out that are bombarding at very chaotic, unrhythmic fashion. Yeah. And so when that happens, the heart is no longer beating rhythmically, a muscular contraction. So the electrical circuitry stimulates the muscle to contract. That contraction is a functional movement. It's going to squeeze the blood. But when now the heart is beating so fast from all these multiple signals, instead of 60 to 100, 300 to 400.
Oh, man.
And so
I've never heard of that.
It's bombarding the stop signal called the AV node that then regulates the number of impulses that get down to the bottom chamber. But now they usurp it. They come, and so now the heart rate may beat faster, but irregularly. Because it's not a functional movement, the heart is twitching on the top portion. That twitching means blood can pool.
I see.
Because blood can pool, clot can form. And so now that clot can then embolize or move and travel down into the bottom chambers of the heart and then out that where it lodges in a small vessel that can then lead to a stroke somewhere.
Yeah.
Right? And that's really the biggest detriment to having atrial fibrillation is the idea of clot formation. Now, with that being said, not everyone has the same risk of clot formation. What we found, it's very comparable if a person lives in the state of California. You have the inland territory and you have the coastal area that's there, right? And so the coastal area, as you can imagine, there's a huge fog and mist that comes over. If I have a plot of grass, I don't have to wire that grass very long. But if I'm inland in Coachella or Palm Springs, where it's a desert-like area, I have to wire that grass an awful lot. Same thing. We have individuals, as our risk factors increase, congestive heart failure,
Oh, I see.
we get more maturing years lived, our age increases, we have diabetes, perhaps a prior stroke, high blood pressure. These numbers, according to research, tell us it increases the risk and likelihood of stroke. And now we may recommend a stronger blood thinner
I see.
at that point. And that's where we get into. And there's other therapies that have evolved over the past 5-10 years. We can do what's called, one area I didn't describe. So when atrial fibrillation occurs, there's little dog ears on the heart itself. We call those atrial appendages. And so the clot can lodge in there oftentimes. And so we will occlude that area there that will preclude the clot. That's where the clots mainly form. And so when we put this occluding device there, that may be a substitute for some patients who are unable to take blood thinners.
So why are some of I do stupid mail tricks, Ironman competitions and ultra runs and all that. And some of my friends are extreme cyclists. Why are they dropping dead of AFib suddenly? I mean, they're slender and they're fit, and then just like that, they're gone.
Yeah. So atrial fibrillation by itself does not typically cause death, but it can cause stroke, right? And so, but atrial fibrillation oftentimes is an accomplice. It runs in a group with other diseases.
I see.
So it may be a marker of cardiovascular disease. It may be a marker of high blood pressure. It may be a marker of diabetes, of other things that can cause a person to succumb to this thing called life. But atrial fibrillation too as well, we know there's an increased likelihood of it occurring inside of some of our ultra marathoners, our marathoners and endurance athletes is what we've seen, what science has kind of told us. It's almost a U-shaped, right? That we see a higher burden as we exercise, it goes down, but at a certain point, it goes back up as we increase. And you think of it, right? I always tell patients this, is that, tell me about the story of the first marathon runner.
Yeah, he
Right.
died.
He died. Yeah, he was going to tell the story back during war times, and after he ran his 26.2 miles, he died. So it's not something we know. There's a whole complex issue that begins to happen with the heart. We see that markers of the heart degradation begin to rise, called troponin values. We see lots of issues have been denoted in research regarding that too as well.
Yeah, wow. And you're speaking like an American when you say 26.2 miles. I went to South Africa and did the Comrades Marathon at 56. You got to go an extra 30.
Oh, wow.
And
Oh, wow.
so extra risk of AFib. So I have two cardiologists because I've got other complications. We've talked about it on the phone. And they're both so freaked out that I should have AFib. They put, all kinds of instruments on me and everything else. After all that extreme sport, they say, yeah, you're a candidate. And my friends, they have to go in for ablations and things like that because they say, oh yeah, I had AFib. It was my third ablation or something like that. But they haven't found a trace with me. So
Good.
How does diet affect AFib? Is it related?
Well, we know, once again, if we go back to the impetus of AFib, we know it's tied to multiple disease states: cardiovascular disease, diabetes, high blood pressure, sleep apnea, right? So all these things, we also know that those diseases are tied to lifestyle. So as we begin to mitigate those lifestyle diseases, there's a possibility we may be able to mitigate atrial fibrillation occurrence. And so yes, have been studies looking at that and showing a decreased burden of atrial fibrillation. But the question is not so much about, is AFib eliminated, but does AFib decrease with lifestyle? And so I think there's enough science that tells us that nutrition and lifestyle can impact it to decrease the occurrence. I'm not saying eliminate it though. That's important. Because that means that there's still residual risk present.
So one of the people watching this is a young widow, unfortunately. Her husband was a cardiologist just like you in Tel Aviv, other hospital or the university there. Age 37, he got abdominal pain in working as a cardiologist among cardiologists, and they thought he had some abdominal problem, maybe a burst appendix or something like that. And before they could diagnose that it was AFib, he died there in the hospital. And so she's grieving. She's been grieving for years. He left behind 3 young daughters and all that. I'm sure she's been asking other cardiologists. This is why I asked this question, because she's watching. She wants to know, how did that happen? Could it have been prevented?
It's so hard to say, obviously, without knowing the details of the autopsy. So I'll be honest, as you're sharing the story, the first thing I thought was that he suffered an acute aortic dissection, which is imminently life-threatening, if not taken care of and recognized in a timely fashion. And that's the most common kind of presentation, something sudden like that, and or a massive heart attack that would have occurred around that time. From atrial fibrillation, as I mentioned, that irregularity of heart beating and clot forming, unless it led to a massive stroke that resulted in death in that particular moment, that's not common in terms of occurrence. In terms of how it happened, most commonly in a young person, if they're not drinking alcohol, which can happen, right? So if a person, there's some relationship of atrial fibrillation to alcohol consumption.
I don't know what his diet was.
And so if there's alcohol consumption, then the question of, was that the primary driver, or did the alcohol cause a toxicity with the heart? And maybe there would have been an undiagnosed cardiomyopathy or reduced heart function in combination with all this that led to an arrest.
I see.
But all these things are just throwing out thoughts.
Yeah.
It's hard to know on a specific individual basis like that. And, I think what's important, what I've always advised patients, especially when there's a sudden death, not recognizable, is doing an autopsy. And I understand different cultures and so forth are not wanting to embrace that. But the reason why is, if there's something there's a genetic predisposition, it gives information so the kids will know and can be tested. There's a host of different things, whether or not it's too thick of a heart muscle, called hypertrophic cardiomyopathy, which is inherited. There's so many different amyloid, which is that may or may not be common. So that's the main reason for really getting to the details and understanding the why.
I see.
And you're not able to change the outcome for his life, but you can change the outcome of the life of his kids or of others around that may be listening in that have something similar.
So you said that one of your great heroes is Caldwell Esselstyn.
Yes.
And I read his book early on too, because as you know, I have all kinds of risk factors. And he makes this bold statement, which is heart disease is a paper tiger that need never exist. And if it does exist, it need never return. Those are such powerful, inspiring words. But when I watched the episode with you and Chef AJ, one of the episodes, when she got to the questions, a lot of those questions were from people that they didn't have atherosclerotic plaques. They had malfunctioning valves and other things. Like I have other things. It's not the plaque. So how do I square Dr. Esselstyn's statement? Is he just talking about plaque?
I learned a long time ago never to make assumptions or speak for someone else.
Right.
But what my impression of what he's saying is he's referencing coronary artery disease.
I see.
Specifically the vasculature that's there in terms of the process of atherosclerosis and what begins to happen and how lifestyle can really impact that to decrease the burden and the likelihood. That's different than looking at mitral valve prolapse or looking at valvular disease or a congenital malformation that's there. Those are different aspects. It almost brings us back to the concept of what exactly is heart disease. And heart disease is almost paramount to saying, I have car problems. What does that mean? Is it the electrical? Is it the body and fender? Is it? And so the heart it's like that as well. So that's what he was referencing, is what my presumption is.
I see. Interesting. Part of your lifestyle is plant-based food.
Yes.
And you're exceptionally knowledgeable about it, and you'll probably talk to Michelle a lot more about it. But you have some severe competition from cardiologists like Philip Ovadia, he's got a very provocative book title, which is Stay Off My Operating Table, and it shows him in his scrubs and an operating table. It's a scary, attention-grabbing book cover. And he advocates the carnivore diet. How do you respond to that?
I say, let's look at the literature, right? I think the literature is it's profound. When we look at the literature as it relates to cardiovascular disease, and we look just starting first with red meat, we understand the burden of red meat. And so we have to move beyond the idea of just saturated fat, although we'll touch on that, right? In terms of the saturated fat and looking at research with that. You look at whether or not you're talking about the heme iron, whether or not you're speaking to as well the microbiome and TMAO and the carnitine that's increased there. We speak about the impact in terms of advanced glycation end products, right? So heterocyclic amines. We start looking at all these components for the way that meat is prepared, and you begin to understand that all roads lead to the heart through the endothelium, the lining of the vessels, and the fact that it impairs it. And so then you move on, you say, okay, well, that's just red meat. Okay, we look at processed meats, lunch meats, slices, all the things that are common that you're buying at the fast food restaurants that are there, that these things, as well as on top of being carcinogenic and leading to cancer, other issues, they promote cardiovascular events, they promote diabetes as well. You say, well, okay, well, what about chicken and turkey and things, the white meats and so forth? Okay, well, we start to look at those and you start to break down, do they decrease the burden of disease inside of you? Do they decrease the inflammatory profile compared to red meat? Well, it's not a lot of studies, but the few studies out there have shown they actually don't decrease the inflammatory burden. They aren't decreasing the atherogenic subparticles that we're worried about causing harm to our vasculature. So if I'm looking at this and they still can stimulate the microbiome, if I look at this, is this a health promoting food? The statement of stay off my operating table and advocating the carnivore diet, that implies it's a health promoting food. And I argue and I say, show me a piece of data that says this is a cardiovascular health promoting food, right? And so at that point, that's really the goal. If you can't show me and demonstrate that, then this is not something that we should advocate. You know, a very simple tool that I didn't originate, but you can look at the red light, green light, yellow light system. It's a very simple, easy way. Is this food or green light food? When I see patients in the office or in the cath lab, I'll ask them, tell me what you eat for your health. And they'll look at me a little strange. I say, well, tell me what you eat for your health. Well, I have chicken, I have eggs. I said, are those healthy? Are those promoting your health? Well, I don't know about that. I said, okay, so tell me the things you're definitely sure that you're eating that are for your health, that you're aiding your health. And we begin to tease out the foods and break down. Really, there's an absence of health promoting foods. And I'll tell them, I said, you're selling arms to the wrong side. You're selling arms to the side that's going to win the war, and you don't want them to win the war, ending your life. You want to sell arms to the side that's trying to defend your body, you know? And it's just like, that's what's so important. You need to feed your body, set your body up with bodyguards. Bodyguards are what we need to protect us. What's the purpose of bodyguards? Purpose of bodyguards is to protect us against harm that's facing us. So we have to choose the celebrities of the food aisle. They're going to enrich us with antioxidants to help us fight off the free radicals, that help fight off all of the issues that are mounting around us. And it's simple. Fruits, vegetables, whole grains, beans, legumes, nuts, and seeds. There is no argument as it relates to that. The power that lies in these choices of addition, of arming our body with what we need in order to perform, what we need in order to protect ourselves. It's an investment in the future. That's what it is. So
your buddy Kim Williams has this famous statement, which is there are two types of cardiologists, vegans, or I think he might have said plant-based, and people who haven't read the literature.
Absolutely.
I mean, yeah.
Absolutely. I mean, I look at my colleagues and, you know, when I started out, so Kim Williams has a national presence, right?
Yeah.
There weren't any Kim Williams. There was Caldwell Esselstyn, there's Dean Ornish, but the light hadn't shone as brightly when I started down this road. And I'll tell you that it took a while for my colleagues not to look at me with a little bit of a raised eyebrow and what is he doing? And I'll never forget, like some of the first patients when I finally committed that, you know what? It's okay if I'm seen as a quack. It's okay if I'm seen as that cardiologist out there. And I finally just committed because I was nervous. I wasn't really quite sure if I wanted to do it or not. And when I did, in the first three patients, sequential patients came to me from colleagues to put stents in and just, hey, can you see them in assessing? And they had transformations. I didn't even have an elevator pitch.
Oh, wow.
I didn't have the knowledge base for it. So this is for those of you out there who are sitting and they're saying, well, I don't quite know enough. You know enough. You know the basic fundamentals of what we should and shouldn't eat. That's really, I just wrote down a few books from individuals and said, you need to try and focus on eating healthier and eat these foods with the green vegetables and so forth. I didn't even have a pitch. I couldn't explain all the stuff I can explain now. They came back and they were better. They were better in that moment. And that gave me the confidence to kind of continue on and recognizing the fact that there's power. And their example set an example to my colleagues. I'm not saying that they all gravitate and they're all completely plant-based, but what they did was they started to be embracing, to be aware that there is another strategy, that there is an approach towards this thing called life and the treatment of patients.
So how much can plaque reverse? How much do we know about that?
So there's actually a fair amount of data that goes back almost to the early 20th century about the potential for plaque regression. First in animal studies and rabbits. And
it's dramatic for animals.
Yeah, absolutely.
I've seen all those studies.
Yep.
I mean, in monkeys, it just opens right back up.
Absolutely. But I'll tell you who really kind of started doing this was Nathan Pritikin. So Nathan Pritikin started doing work out the VA, looking more at peripheral vasculature, and showing reversal, showing an improvement that was there. This is preceded doing Dean Ornish and the Lifestyle Heart Trial. But apart from that, we've looked at medications, pharmaceutical interventions, and have demonstrated by plaque regression that's there. People say, well, if I drop off 2% of my plaque, does that really matter if I go from 55% down to 50%? That's not significant, but it is. Because when you look from a law of physics and what we call the Bernoulli equation, and we start digging down into the way flow is distributed, every small amount is essentially quadrupled, and it increases the flow. And so I tell patients this all the time. What's our goal? Live longer, feel better. What's our goal? Prevention of symptoms and prevention of heart attacks. If I accomplish that, I don't care if you call it reversal, remission, or magic. That's my goal, right?
Yeah.
And so studies have shown that you can stabilize the plaque lining, which means what? That I'm going to make it less inclined to erupt. So the way I describe it is that you have to imagine if you were to take a teenager that has pimples and you imagine that on the inside of your arteries, that's essentially what we're dealing with.
I see.
These areas of pockets of inflammation that are ready to burst, that extend out. And so what do we tell our teenagers? Wash your hands, don't rub your face, don't eat the fried foods. We tell them all these things. Don't drink as much sugary sodas. Why? So you're not increasing the inflammation. You're decreasing the burden of the likelihood it will erupt. In the body, when it erupts, that's when heart attacks happen, when the body goes into overdrive, trying to heal those areas there.
And you just don't see it because it's inside your body and there's
That's
no
right.
nerve endings.
And there's no symptoms.
No symptoms, yeah.
So you're unaware of it.
I
You
see.
think, I tell every patient this, the only difference between you and me is you have heart disease.
I see.
You you have coronary disease.
Yeah.
Everyone else in here, nurses,
Yeah.
janitors, doctors, we all are walking around thinking that we're okay and we're not
Yeah,
because there's no symptoms.
interesting. So Dr. Esselstyn shows a couple of patients who had dramatic reversal. And I heard him say, you know what, I think it may be because they were younger, they were in their 40s. And maybe that's the case with the animals. The animals are younger. With me, I had, so in junior high and high, I lived with my dad and he was near carnivore. He was an Atkins devotee. And we had meat for every meal, all three meals. So when I got in my 40s, I had to have these life insurance exams because of the business I was doing. And they did a carotid ultrasound, yeah, and said, oh, you have medium plaque buildup. And it's a little bit threatening. We're going to charge you more for life insurance. And that caused me to go more and more plant-based and eventually 100% plant-based almost 20 years ago. And I just went back for more sophisticated tests. And the cardiologists who were worried about my AFib said, whew, it's amazing how well you did on those, CT imaging studies and all that, where they put a dye in you and everything, where I guess you can actually see soft plaque. And,
Yes.
And he said, oh, you really don't have anything to worry about. So is it because the carotid ultrasound test was just not that accurate? Or Is it that I made progress because I did it when I was in my 40s, or anyone's guess?
No, so you definitely, so one, the carotid intimal medial thickness test is extremely helpful. It's predictive of cardiovascular events, and it's one of the measures that we check.
Yeah.
And so the fact that that actually regressed is a huge finding, right? The time we understand, the reason why we talk about the onset of when a person adopts that dietary practice is because of what we call the small thin caps, the areas that are not well formed. So the way I describe it is, if I were to go to your home, right, and once again, your wife says to you, honey, I want you to build a pool, right? So we start digging up the ground in the backyard.
Yeah.
You recruit me, we dig, we pile all the dirt up on the side. If you kick that dirt, it's gonna kind of crumble a little bit. If that dirt pile has been there for centuries on centuries on centuries, like the Grand Canyon, you're gonna break your toe. As plaque builds up and it's hard and it has a hard casing over it, it's harder to regress those areas there. But you're constantly building up new areas. So what you're regressing is you're trying to regress that inflammatory core, that necrotic core, by decreasing some of the cholesterol and so forth. And that's essentially the concept.
I see.
Yeah.
You're really good at these analogies.
Wait, say that again.
You're really fantastic at these
Okay,
analogies.
so if my sister ever watches this, because she says that I go overboard, and she's like, not you and another analogy.
Oh, well, let's give an example. Talk to me about Teflon lining, epithelial layers, and garden hoses.
Yeah. No, I think it's important to have practical references for people, everyday references to get an understanding of what we're dealing with, because it's hard to visualize your body. It's hard to visualize the vessels like that. And so I use the analogy of a Teflon pan, which I hope no one's using anymore. Right, the Teflon
You know
pans,
about
right?
PFAS chemicals, forever chemicals.
Yes.
Not many people do. No, not enough people know about them.
It's a problem. It's a big problem. And so, but using that analogy, when you buy that Teflon pan years ago and you put something on there, nothing sticks.
Yeah.
You can put, excuse me, those of you who are staunch vegans and plant-based like myself, you put eggs and cheese on there, nothing would stick to it. Once that pan gets worn, everything sticks to it. That's like your endothelium, that when it's healthy, it's saying no to disease because it's releasing NO, nitric oxide. And it's an active organ that dilates and constricts. It prevents platelets from clumping together, or clots from forming there. It prevents the inflammation. And so it's so powerful to really take care of it. So the question really arises that once it's broken, it's disease, can it be repaired? And there's some inference that we can improve the endothelial function. In most instances, our attacks on the endothelium are transient. We'll have our donut and coffee, or I should say our sweet milk with a little bit of coffee and a bunch of sugar inside of it, right? And we have our donuts and we have all this stuff. Then we leave from that. And then we have like our pizza or our burger. And so every time our endothelium starts to improve, we hit it with another attack, and subjugating it to it. So it becomes important as we look at our overall health once again.
I have one thing to say to your sister, so I'll look at the camera and say it, which is, he is really good with these analogies.
I'm gonna make sure I have her watch that and replay it over and over and over again.
Put that as a reel on
That's
Instagram
right.
or something like that. So I have to say something a little bit controversial. You're the nicest guy in the world, and so maybe you'll squirm a little bit with this, but it's me, not you. And that is, I'm an earth scientist by background. So since the 70s, we have known about climate change and how hot it is. It was 115 in Sacramento today, right?
Yes.
It was 108 here when I was setting up lights. And we thought, we're all freaking out. All earth scientists are all freaking out. And all of us that I'm aware of, I don't know any exceptions, have all gone 100% plant-based. And the food that is the most offensive, that has the most impact, is red meat, by far. It has 10 times the impact on land use, water use, greenhouse gases and everything of fish, pork, chicken, and 100 times over rice and beans and all those things. It's just, we've deforested almost half the earth. I gave a TED talk about this. We've deforested almost half the earth. And we use the footprint for agriculture right now is 4 billion hectares. If we didn't eat beef, it would be 2 billion hectares. That's half.
Wow.
If we didn't eat dairy, which comes from cows, it would be 1 billion hectares. You can still have the fish and the chicken and the bacon and all that stuff. It's beef with the way their digestion works and everything. It's just obscene. And so this is the controversial part where I'm going to get a lot of comments. To me, it's depraved to have somebody promoting beef, not just from a cardiovascular point of view, as a cardiovascular surgeon or something like that, because I haven't read the literature, but from an earth science point of view, this is 2024. Earth scientists have been worried about this since the 70s. When I was a grad student in the 70s, we're worried about this. It's 50 years later. I mean, come on. It's the second biggest factor. And it's the one factor we can all do something about. When people get in despair about, climate change, well, there's something simple, go have a chicken burger or something like that. I mean, it's not kind to the chickens, and, there's there's animal cruelty, there's all those things, but it doesn't have the impact of beef on the planet.
Yeah. I think part of the problem is with people is the fact that we separate ourselves, especially physicians. We're notorious for this, that it's almost as if we're outside of our bodies practicing on people.
I see.
And so that's why you would see historically physicians going out to smoke, despite treating severe vascular paths. Because once again, we all have the perspective of it's not going to happen to us.
Yeah.
And so when you layer that on, just the emotions behind it, the emotional connection to whatever the food products are, that alone, now you tie to it the lack of knowledge, right? Because it's something that is that's not emphasized. And so I've said this 1,000 times. As every other physician, I was not taught about nutrition inside med school. And you may have heard me say this before. My colleague actually said it first. And so resources go where value is placed. And so why wasn't I taught that in medical school? Well, because the boards didn't. They didn't ask questions about that. So then why wasn't I taught that inside residency? Well, once again, the boards didn't ask those questions. So then why don't doctors ad nauseum just practice and really learn it and practice and lecture patients about it? Because reimbursement has not been there.
I see.
So there's no value attached because there's no resources attached. So there's zero. So now you amplify all of my own personal associations with whatever the food product is. And now I'm immediately skeptical and see that's witchcraftery, that this can't possibly be it.
Yeah.
But I love the quote, and I quote this in like so many of my lectures, which is of Albert Einstein, which is, not everything that counts can be counted.
Yeah.
Right? And not everything that can be counted counts. And so when you start to open your mind and realize the fact that what we've been practicing, the way we've been practicing this Western style medicine perspective, not saying that it's completely wrong, but it's not the entire picture.
Right.
Not even the slightest bit. And when you add into the environmental impact, and I'll tell you why the environment's important to me as a cardiologist, even beyond the plant-based component with it, is because we see the impact on cardiovascular events. The increased platelet aggregation, clot formation.
Because of the heat?
With the increased heat index that's there. We see the increased cardiovascular events. We see the intolerance with the medications, the dehydration, all the things that happen in the increased burden. We see the impact of pollution that begins to happen as we see the air quality. When that air quality is impacted, the increased raise in terms of cardiovascular events, AFib as well. That when we see the noise from the pollution from the inner cities, that noise decibel, it triggers, these all trigger stress in our bodies, and that stress begets disease. So when we look at the way our communities are created and that they're partitioned, we're seeing the confluence of this excessive heat, of noise, of pollution, the absence of food deserts, apartheid states, that it's a perfect crucible for disease to really flourish. And we ask ourselves, why are we not stamping out disease?
I know. It's just right in front of us.
Right?
It's just so frustrating. So I'm going to try a Batiste-like analogy. To me, as a neuroscientist, it's like, it must be for a doctor, an oncologist, say, does a chest x-ray and looks and sees a tumor and does a biopsy and finds out it's malignant. So he has to sit down, or she has to sit down with the patient and say, you got a malignant tumor in your lung. We better act on that fast. And having the patient say, you know, are x-rays for real? You know, because I'm not sure. You're just showing me a picture. I don't see any. I feel fine. And you know what would make me feel better is to go outside and have a smoke, you know. But I want to think about this a little bit. Maybe, you know, I'm planning a vacation and things. Can I check back with you in 3 months? And that's the way we're reacting to climate change. If you're an earth scientist, you know, it's like, dude, you got a malignant tumor. You better do something.
Absolutely. And you said that as an example. I've lived that with a patient.
Oh, really?
Examining their heart, and their heart rate was extremely fast. And I had a monitor assessing their implanted device, and they did not believe me.
Wow.
Because they didn't perceive the symptoms.
Wow.
And I said, look. I said, I don't believe this.
Yeah. Wow.
And I thought actually I was on candy camera in that moment, because you know, it's like, you need to get treatment for X, Y, and Z. And so you do encounter that every once in a while, this level of disbelief that's there. And I mean, all we can do is continue to educate and continue to strive to hopefully make the appropriate, get involved to hopefully be a part of change, so we can hopefully stop it.
Speaking of that, have you cardiologists and scientists just been lying to us about LDL cholesterol? There's a whole bunch of books saying lies my doctor told me, and cholesterol is one of them, that it's healthy. It's not unhealthy. Higher is better. What do you say? You have a kind of a sick look on your face.
Well, I mean, once again, when we look at the literature, it's very similar to many other. You look at any infectious type of environment that's there, right? And so if I walk into a room with tuberculosis, it probably makes sense if I'm in that room, the longer I'm in that room and I'm exposed, the more likely I will contract the disease from tuberculosis, right? That not just being infected, but contract the disease. That makes intuitive sense, right? Same thing. The longer my body is bathed inside of cholesterol, elevated cholesterol. So not just elevated cholesterol, we have to look at cholesterol from a different perspective. We have to look at cholesterol like a room filled with balls.
Yeah.
And I look at this room filled with balls, the beach ball may not hurt me. It's true. The basketball may not hurt me. But guess what? That golf ball, if I throw it at you, is going to hurt you.
There he goes again with more analogies.
Right? That baseball is going to hurt you. So yes, if I'm saying that I estimate that there's going to probably be a fair amount of baseballs and there's going to be golf balls inside there, when I say that there's tons of balls in this room, I probably don't need to check to see how many golf balls precisely. But the golf balls are the key. The baseballs are the key that are causing disease. So to say that the subfraction of components of cholesterol, which is multiple components, that it's fantasy and that it won't cause a detrimental effect, of course that's wrong. Saying that it's good for you, well, yeah, in the right situation, elevated blood pressure is good for you. In the right situation,
When you're exercising.
yeah, in the right situation, when a dog is chasing you or a bear is coming down the mountain at you, your body goes and turns the key on the ignition for the stress hormone cascade to start happening, right? Your pupils change, your blood pressure rises, you get gluconeogenesis, your liver produces blood sugar. You create this diabetic state. You create a hypertensive state. That's good transiently. Is that good long-term? Nobody on the face of the earth would tell you it's good long-term.
Yeah.
So why would I think that cholesterol, or specifically low dense lipoprotein or small dense LDL, or components of apoprotein B or of lipoprotein A, that those are, it doesn't cause a problem, when every study has told us that the higher the level is, the more inclined you are to have that. I'll tell you a personal story, not personal so much, but someone that I treated who came to the hospital and was a family friend, looked amazing, looked younger than his stated age. And as I went back through his chart, his cholesterol was through the roof, year after year after year that it was ever checked. For whatever reason, his decision, his doctor's decision, wasn't placed on medications. His vessels looked like those of someone about 30 years his senior.
Oh, wow.
They looked like someone who was diabetic, which is the equal with having form of cardiovascular disease, and were completely disconnected from what I would expect looking at him on the outside. That's the impact of having your body bathed in elevated cholesterol, where it appeared like if he may have even had a form of familial hypercholesterolemia, meaning that he's born with it. So now from his youth all the way into 50s, He's under this exposure for that period of time. So it's important for us to inspect what we're expecting with it, as it relates to our lifestyle, our practices, not only to understand what those numbers are and what they mean.
Should we light up the comment section now?
Yeah, let's hit it.
Statins.
Yes. Statins it depends on the indication and their place, right? And it also depends on the patient. So if I have a patient, and for those of you out there listening who are agreeable to being extremely aggressive in terms of nutrition, right? And so I don't like labels. I don't like labels of vegan or plant-based. I like, tell me about the quality of food that you're eating, right? If they're eating high quality food, did the research include individuals who are intentional like that? Probably, no, they did not. Can there be value inside of doing that? So on an individual basis, I will work with that person. I might say, okay, well, let's have you on the cholesterol meds for right now. Let's get you on there, recheck your labs. Okay, let's back off the cholesterol medications. Let's do a follow-up. What's your numbers after you're off the cholesterol medication? What's your risk, right? And then I have patients where they say, Doc, I'm all in this. I don't see them for a year or two, and they fall off the wagon, and they're back. Now they have no
sky
high cholesterol coming back in because now they're having symptoms of chest pain.
I see.
And so now the question arises, should you have stayed on it or should you not? So this idea of medications, whether we're talking about statins or any other therapy, there are going to be risks and there are going to be benefits to it. And the question is, what are you going to do in terms of what's the worst case scenario if you don't take the medication? What's the worst case scenario if you do take the medication? Which is most acceptable? And not taking it doesn't mean isn't good enough. You have to do something. And what are you willing to do on a daily basis, every single day for your health? And so it's a long conversation that I have with patients. Am I anti-statins? Do I prescribe statins? I have. Do I understand the risk associated with it? Yes. Do I understand the literature that relates to statin therapy? I think the studies somewhat show that nearly about 50% don't even feel it once they leave the doctor's office. They do the old adage, yes, no, I'm not. Yes, no, I'm not taking it. They give discordant answers, right? And then the percentages of drop-off increase after that. But we also know that individuals who've had events, heart attacks, strokes, etc., who don't take it, have a higher likelihood of recurrence. Why is that likely? Because their inflammation hasn't gone down. Their cholesterol hasn't gone down. Their lifestyle hasn't changed. They're doing the same thing, expecting a different outcome. And that's not going to help.
So this is probably routine for you, but for me, I was at my stepmother's rest home and they brought out a meal and there was some kind of obscene coconut cream pie, and there was a woman sitting across the table from me who was saying, "Are you a doctor?" I said, "No, I'm not a doctor." "Well, you look like a doctor." And no, I'm really not a doctor. "Well, you're not going to judge me for what I eat, right?" I said, "No, I'm not a doctor or a nutritionist or anything like that." And I was thinking about my stepmom who had Alzheimer's. And she said, "Well, good, because I'm going to eat this pie and I can do it because I'm on a statin and a statin protects me. That's why I take the drug, so I can eat the pie." How do you respond to that patient?
Oh, that's pretty common. And what I'll tell you is the fact that we know beyond a shadow of a doubt that many people, even with their cholesterol that we check, the general cholesterol values, are still likely to come in with the heart-related events, heart attacks and strokes. And so we know a large percentage still present that way. And it's because of the impact of the foods that it's not the medications alone don't decrease the burden. They don't eliminate the burden, rather. They do decrease it. They don't eliminate the burden. And the question is, what do you want? What are you comfortable with? Are you comfortable with a 10, 15, 20, 25% risk of a recurrent event? Are you comfortable with having to go back in with a heart attack or with a stroke? Or are you not comfortable with that? And you have to ask yourself, what do you want? It's a great book by a psychologist, Kelly McGonigal. Right? I talk about her a lot, the willpower instinct. And she says, what do you want? What are you willing to do to get what you want? What won't you do to get what you want? It starts with, what do you want? Right? And why that resonated with me so much is that when I was in training and I was still learning. I remember this wonderful doctor. She was like 6 foot tall, Norwegian woman. And she said, Batiste, what's your impression in your plan? Your plan has to match your impression. So I tell patients all the time, what's your impression? What do you want? If your impression is, I want to be healthy, what's your plan? What are you doing? Your impression is, I don't want to have another stent. I don't want to have to come back and see you. I don't want to be hospitalized. That's great. What's your plan? What are you doing to impact that, right? And how are you doing that? And it can't be a nebulous. You have to put pen to paper, and we have to work together to really outline what your approach is going to be. That may include medications. That may include aggressive life. It should always include aggressive lifestyle. They're not discordant. Sometimes they're both are needed to achieve your goal, right? Because why? We have to, once we start down the pathway, it's not good enough to be on the medications or to start on a nutritional plan. You now have to check a status check, right?
Yeah.
A heat check, in sports, right?
Yeah.
What's my cholesterol doing? What's my A1C for diabetes doing? What's my blood pressure doing? And if it's not meeting the goal, that means something else has to be added or changed consistently. Yeah.
So tell us why you want all of us to be more selfish.
We have to be selfish. So I'll tell you, the easiest way I would tell you about why it's important to be selfish and how that term came to being was, I always joke and I'll say that I was watching the third greatest basketball player to ever lace him up in Michael Jordan. Now, if he's watching this, Mike, I'm joking, man. You're one of the greatest. You're probably the greatest, right? But irrespective, he said, in order to be great, you have to be selfish or else you'll never achieve. And what he was referencing was really the process of team sports, of achieving your greatest height. But there's so much truth to that. Because how often is it in this journey towards this thing called health and life or career or whatever it may be, that you have to not follow the path of everyone else. So your friends may tell you, may go out for a party and they're doing this, that, and the other. But if your goal is to study, you're staying in. You have to be selfish. That if everyone else is eating something, you're looking like the odd person because guess what? You're eating healthy because it's selfish for you to do what's right. And so there's a component of being selfish in a practical definition of that that's so imperative for a person to achieve health. But on a real granular level, selfish is an acronym.
And you want to quickly tell us what each letter stands for?
Yeah. So the S stands for spiritual, right? E for exercise. L for love. Love as action, not now, but an action word. F for food, real food, whole food, plant-rich foods. The I stands for intimacy of relationships. That becomes important. The second S stands for sleep, rest, vacation, naps. And the H stands for happiness, humor, joy, all those aspects, laughter, that become important. And so really, I want everyone to be selfish because what we understand, we break down is that when we get selfish and we apply these principles, studies have shown it not only decreases our stress, helps us understand and deal with stressors. It helps decrease our perceived stress. It also helps heal our endothelium, our lining of our vessels, heal our heart, and can help really transform our outlook in terms of cardiovascular health.
Wow. So this H part, humor, that and the studies associated with it really surprised me. So do you want to share just how powerful humor is for health?
It is. Well, I'll start first with something very simple, smiling, right? So just the sheer act of smiling has been shown to lower blood pressure. I was saying in Ocean Robbins and I were chatting, he told me about a scenario where someone said, you know what, try and look up at the ceiling. Look up at the ceiling and smile. And try and see if your mind goes to anything negative when you do that. It's hard. It's hard to do it. So when we look at studies over laughter, studies over happiness, studies have told us this positive affect has been associated with lower blood pressure and longevity. But the study I love the most, right? Study I love the most is one in which patients who suffer with a heart attack, with heart failure. And so we put these patients into what's called cardiac rehab. Cardiac rehabs where we're teaching about nutrition and education, stress reduction, taking your medications, and it's been shown to be life-saving. But to one group, they said, you're gonna do this. Other group, you're gonna do it too as well. But the second group, we're gonna have you watch 30 minutes of whatever makes you laugh. A sitcom, a comedian, whatever it is, laugh every day. And what they found was so amazing. The group that laughed, all of a sudden, guess what? lower risk of chest pain, lower rates of readmission to the hospital with heart attacks or with heart failure. And so profound, we see this, that individuals who laugh do better because it impacts the endothelium. It helps the lining of the vessels of the heart. And so it's so powerful, this idea of joy that's so absent in our society.
Yeah. And you said you like to ask your patients.
I do. It's, you know, it's
When's
always
the last time you laughed?
Absolutely. That was one of the main things. It was just like, tell me the last thing you did for yourself, the last thing you laughed about. And I'll tell you, everyone, yeah, it's killing cute, right? But everyone, they would pause. And it just told me about the level of stress people are under, that they don't even have time to laugh, to smile, to look and think about things on the bright side. And that's sad that we don't have that.
Yeah. And then in your own life, have there been times when you've had to be more selfish to take care of yourself?
Always. I mean, well, first, when it comes to eating or food, that's always a scenario, right? Because whether or not food is so social, it's emotional, it's relational, and people have expectations. You come to their home, I want to feed you, right? Or they want to give you something. And so when you don't partake, and everyone else is, it's almost a level of offense. You're being offensive to them. And so in order to get past that, you have to be selfish in order to get past that. That sometimes in order for sleep, right? Long day at work and families up watching movies and you know, listen, I need to get my sleep. Why? Studies have told us when we go to bed, not just the length of time we go to bed, but when we go to bed is so important for our cardiovascular health, for our mental functioning, for the future. That's important about all those aspects. But when you choose to go to bed, you're being selfish in a sense. You're removing yourself from a situation because you're prioritizing yourself, which will be seen as selfish, right? And taking those times. It could be something as simple as everyone taking the elevator and you choose to take the stairs, or choosing to park further away. Instead of circling around that parking lot for 5 hours looking for the closest parking spot, you park further away and walk in. Those extra steps, that activity, that's being selfish in a sense. Those with you may not appreciate that as much, right?
Yeah. And your book just has so many wonderful, wonderful studies, many of which are just actually very surprising. What to you was the personally most surprising discovery you made while writing this book?
Oh my goodness. There were a lot. There really were a lot of studies that impacted me over each of them. And as I poured into it, trying to research out just the level of science as it relates to stress. I'll tell you the one that I think was the most powerful for me was the breathing. So I talked about spirituality, and spirituality to different people, oftentimes they get turned off because they think of a religious connotation. And there is, you know, everyone has their belief and I have a belief system and so forth that I is a foundational piece for me personally. But whether or not it's prayer, whether or not it's meditation, but simply breathing. So you look at the Latin root of spirit, that's breath, right? That's breath. Spiritus is breath. And so when we look at the power of breathing, of taking deep breath, that's an Eastern thought process in terms of medicine and so forth. But when you inhale, that's activating the sympathetic tone. As you exhale, it activates your parasympathetic tone, which helps to dilate the vessels and rest. So why do people sit and take a deep breath before they speak to someone or they're inside of a stressful situation? Because they're trying to calm. The one I love the most is the physiologic sigh, right? That's what kids do, just innately. Oh, as they cry, right? Every kid, you know, they would do it all the time and they pout and do all of that. And you think they're soothing themselves. In that moment, they're actually actively lowering their stress hormones in that moment. The one I talk about a lot is even crying, that it helps release the stress hormones that are there when we do these things. And so there's actually functionality inside all these processes that we just observe every day, but don't acknowledge the importance of it. And we walk around not really breathing like we should. Right? Why is it? Well, because we're in a vain society where I have to hold my stomach in, right? And I'm wearing my little belt and everything like that. I gotta make sure, right? I'm posing on. I'm posing on social media. I gotta show my guns or do whatever else. And you're doing all this stuff. You're not breathing. What happens when you're stressed and you're uptight? You don't breathe. As you're holding your breath inadvertently. And so the power of the breath is so important. I think that's one of the things that really was fascinating to me as I started doing research and digging into it and reading the studies and so forth.
Interesting.
Yeah.
Thank you.
Yeah, absolutely.
And was there anything that didn't make it in the book that you wish were in there now?
Oh my gosh. There was a lot. So I'll be honest. Probably the longest section in the book was I was given guidance from the publisher to not make this a novel, right? In terms of 500, 600 pages. But the food section, there was so much that I felt I left out that I could have touched on even more so in terms of the food section, to be honest with you. As we look at just the power and the impact in even more greater depth than what I went into, that may be helpful to individuals. But there's always a role for part 2.
Sequel, yeah.
Yeah, a sequel, you know?
Yeah.
So, I mean, because the idea is selfish, there are specific, all these pillars apply to every segment of the population. So when I see selfish for students. I see selfish for teachers. I see selfish for preachers. I see selfish for mothers, for new parents, right? And this idea of prioritizing for married couples, right? I mean, it's not easy to be married for 50 years or 26 years or 10 years or 5 years. And so what are some of the key things? And when you really start to parse through those, there's some powerful data that's there. I actually started looking into that. You start take married couples for a second, and you start looking at it, that the power and the impact in terms of empathy that is brought on by engaging in meditation and prayer for your spouse, the more inclined for forgiveness, to be receptive of actions. As you start to look in terms of the exercise that from a component of coming together, the oxytocin, that connectivity that's there. There's just so many aspects. I think one of the key things too as well was the loved one. I would always joke about love, right? I would joke, say, I'm a love doctor, I'm a heart doctor, right? But when you really look at the power of forgiveness as love in action, the power of gratitude as love in action, it's an action word, it's a verb, it's something that's action oriented. I always joke and say, anyone who's loved anybody or anything, they know it takes work, it's time, it's effort. And just seeing the research that's been done on forgiveness alone, that forgiveness, that when individuals who engaged in forgiveness, that they had improved blood flow to the heart muscle. When they started off with restricted blood flow, the blood vessels, the perfusion scans showed improvement in flow after going through sequential weeks of forgiveness training. That's powerful. The impact of the mind of just choosing. We always think of forgiveness of, I'm giving this to someone else. It's not, it's for us. It's for us. When we forgive, it's actually helping to heal our hearts. And so we have to do that. When we teach our kids to say thank you, we're not doing it just so they can be polite. Studies have shown that it lowers the blood pressure. It helps longevity. It's going to help overall their ability, their diabetes. There's so much, once again, the idea that not everything that counts can be counted. These simple things, they add up to an awful lot. It really does. And so that's really what I'm trying to convey, is the fact that what I've observed in practice, and I've taken care of individuals, some of whom have been plant-based, some have been vegan. It's like, how did this happen to me? How did I have another heart attack? How did I have this? And one of the things that I'm seeing is they're looking at this. You take the perspective of a team sport. Everyone's looking for the superstar, which is food. The superstar, I got the superstar, I'm gonna win a championship. No, you're not. You're gonna win a few games. You're gonna win games. What's your goal? The championship, increasing your health span. That means we need a team that maybe is less accomplished. You need the spirituality. You need to exercise your teammates. Your love is your teammate. The intimacy of relationships is your teammate. The sleep, the humor are all teammates to help support the superstar in nutrition. And so you can't win as a team unless you have teammates that are there. So I'm trying to fill the slots and have everyone understand, recognize that there is power for each team, that teammate that's there. I love sports.
And you love analogies.
Yeah,
That's
I love,
a really good
I
one.
love sports,
That's great. We can never have enough references.
Yeah.
Yeah. So now that this book is out and you've got these teams coming up in terms of these 7 foundational pillars of how to be more selfish, what's next?
Yeah. Well, I think I want to tease these out more. So I'm trying to create a community, or I have created a community for individuals to come to and hopefully really delve into it a bit more, dig into what it means. Because it's easy enough to say to do something. Just be better. Okay, what does that mean? And so one of the concepts, and I talk about this in the book, is we have to, number one, implementation intention. We have to begin the process of writing down our plan. How am I going to do it? When am I going to do it? Where am I going to do it? How, to whom am I going to do it with or for or whatever else? I go down that road. Once I make a plan, you have to kill the plan. Pre-mortem planning. So the idea is, in medicine, we have a group of doctors called pathologists, right? I call them like the archaeologists, right? Indiana Jones, for those out there, remember Indiana Jones, archaeologists. And so what they're doing at that point, they do an autopsy to find out why a person died. Doesn't help the person. Person's dead. Doesn't help them at all. So the idea is pre-mortem planning from a business perspective is, let's create a business plan. Let's kill the plan, every reason why it's going to fail, then let's solve for it. While it's alive, before it's been killed. So if we do that, how can I eat healthfully? What can I do if I'm inside of an environment where there's no grocery stores open? I don't have access. There's no Uber Eats. There's no whatever your favorite delivery service is. How am I going to eat healthfully? What do I have to plan on doing in order to maintain my progress? What am I going to do when I go out for the birthday dinner with my friends? What am I going to do when I go to the reunion with the family? How am I going to maintain this mindset? And as you begin to now kill that plan step by step and you solve for it, you're more apt to be successful. And it doesn't end there. Once you do that, now you have to track yourself. Hold yourself accountable. Use a rewards calendar, put an X on every step. So part of what I'm doing in the community to really build on that is really to help folks understand this process and to make improvements. That law of 1% is so powerful, 1% change. As you aggregate that over the course of a lifetime, those are huge dividends.
Yeah. And is this through Kaiser or your own program?
So not through Kaiser, so this is separate. So everything I'm doing here with the book actually goes into the nonprofit that I had set up several years ago. And what we're doing is we're engaging the community. We just participated in a wonderful event where with young students in essentially creating a Shark Tank, and we helped sponsor funding for them. Such an amazing young lady came up with an idea for visually impaired kids so they can be on the playground. And so she researched it. She's in 8th grade, eyeglasses that will essentially have like a buzzer or a sensor similar to a car technology. As a person gets closer to an object, it'll buzz to let them know to move away from it. So working with ophthalmologists. And so she won $2,000, part of the sponsorship. Others won funding. And so we do different things in the community to inspire STEM, like, science and technology and engineering and math, also from a core component of health. So plant-based nutrition inside barbershops and churches and communities. So the funding goes towards that stuff there.
That's so awesome.
Yeah, so that's where it goes.
Yeah, and tell us more about this nonprofit, the name of it, and specifically the communities you're targeting.
Yeah, absolutely. So it's called Healthy Heart Nation, right? So the idea and the concept, so it's interesting or maybe not so interesting. So I started the nonprofit, and then I said, I don't have the bandwidth for really running the nonprofit. So my wife agreed to do it. And she said, you're always talking about a holistic approach. You aren't just talking about heart health alone. She was like, you talk about the community, you talk about the education piece, about the business, financials, you talk about all these aspects. So she's like, we need to make that an important piece. So this nonprofit addresses the physical health, the education in the community, business aspect that's there too as well, and legal or justice aspect. So it can be well-rounded for communities at risk. And so our goal is to target African-American communities, really all communities, to really kind of bring an awareness about the power of nutrition. And I always tell everyone, it's almost, as an interventional cardiologist, my job is to treat everyone to help stamp out heart disease. But if I have you as my patient, you're waiting for me inside the outpatient bay, and I have someone who's really on death's door, I'm going to address their issues because it's important, not that you're not important. So I believe it's important, and there's so many communities out there that are at risk and that their burden of disease, most recently, the president of the American Heart Association came out with the statistics and prediction for 2050 on cardiovascular disease burden. And the expectation is there's going to be an increase in cardiovascular events, nearly 60%, increase in diabetes, increase in poor eating habits, and disproportionately inside communities of color. And so that tells us that there's a lot of work that still needs to be done because this impacts our healthcare dollars, it impacts our access for care for everyone inside hospital systems. And so that's why it's important.
Yeah. I see. Thank you.
Absolutely.
And last question.
Right.
So you and Chris talked earlier about how, with earth science and climate change,
yes,
what we're experiencing has just been so devastating,
yes,
and it just seems like it gets worse every year.
Yes.
And just now you're telling me these statistics about like diabetes and cardiovascular incidences. Those are also increasing over time.
Yes.
So things seem pretty dire. And especially young people like me, we're like, well, this sucks. Like, what am I to do?
Yeah.
What are the kind of, what are some rays of hope that can shine in us to show that we can actually turn around these depressing trends?
Well, I think here's the thing. What I'll tell you is this. Imagine 25 years ago, there weren't very many plant-based options inside grocery stores. So I'll ask you, I'm gonna turn the tables as I get to the point there. I'm gonna ask you a question. Mm-hmm. Do you think that was the good graces and just the benevolence of businesses to say, let's add in these plant-based options?
No, they added them because people started demanding them more, the money. Exactly.
Follow the money trail. And so you said something. You said people demanded them more. Individuals that you aggregate begin to drive change. I think that's the power. I think that's the power of what our next generation, our youth have to understand, is that there's so much power that's in your hands on social media to drive change, of influence that's there. And that power has to be used for good, not for bad, right? That when we begin to shine a light on some of these issues that are there and begin to really make actionable steps, that we can really turn the table. I believe that there's a huge hope, there's huge opportunity that exists by understanding of the projections are just that. They're projections. Who cares about the projections? They haven't happened yet. We still have the ability to stop that from happening based on what we choose to do right now collectively as a society. And so I think if we can move that way as a unit together and come together and recognize that we're on the same team and that this tapestry of life, I mean, I love I'm not a gastroenterologist, but I love the concept of the microbiome. Mm. And we understand what's one of the things about the microbiome where you have all these bacterial cells that are more than our human cells, is the fact that they are diverse. The more diversity that you have in your microbiome, the better you're able to withstand disease. The more diversity you have in your microbiome, studies have shown, even with the SARS-CoV virus and hospitalizations, that survival is improved. That's a small reflection of what the world should be like. The more diversity we have, the integration that we have, the voices at the table, the ability to bring different perspectives, that means it's empowering. It's not disabling, it's empowering. And when we begin to understand that and recognize the value of each individual, we can move towards a better state, And as you get a little bit older, a little bit more gray hairs and things of that nature, what you start to realize is the fact that you're hopeful that your actions are going to leave the world a better place for the next generation. And that's really the goal, So when you ask hey, why are you doing this? That's really the reason why. It's a selfish reason. I have kids. I may have grandkids who won't know who I am at all. Well, maybe now because I have a book. They may be able to say, I think he wrote a book or something like that. But the goal is for the world to be a better place. I'm not so dismal that I think that's not in the realm of possibility.
That's amazing. Also, are you going to run for president next year?
No.
You just delivered some really compelling.
No, not even. I stick in my lane. Oh. I'm an interventional cardiologist, passionate lifestyle enthusiast, and father, husband, all that stuff there, author now. Mm-hmm. And so I do these things that I'm passionate about.
Oh, and you're changing the world. Thank you so much.
Yeah, it's been good talking with you.
Thank you.